Welcome to Fuzzybutts and Friends. Well, as much as it drives Fuzzybutts all over this place, absolutely crazy every time they hear me say it. I am the host of the show, Yer Big Dog, Luke Robinson, and I'm glad to have back again with me this week Ginger Morgan. She's the executive director of the Puppy Up Foundation. She's occasionally, most often, the co-host and co-pilot of this show. Ginger, how are you?
I am doing really well. I will tell you this, I am so glad that you and Grayson are off the road and walk 3 is complete and everybody is safe and home.
Absolutely. If you're watching this on our YouTube channel, you will notice behind me the banner that says Fuzzybutts Studios. I just got back to Fuzzybutts Studios 2 hours ago. That's why I'm looking rather haggard and unshaven and unshowered too. But I just got back from a 16-hour drive from New York and the end of Walk 3. And I got here just for this episode. It's a powerful, painful, and perhaps maybe one of the most important episodes, Ginger, that we've done here on Fuzzybutts and Friends. And for Ginger and I, it's a personal one too. So this is part 2 of Dr. Andi Flory. She's the Chief Medical Officer of PetDx, here to continue our discussion about their incredible, amazing, powerful, and personal technology, the Onco K9. It's a multi-cancer early detection technology, and I'm excited. We have a lot of ground to cover. Dr. Flory, how are you? Welcome back.
I'm good. Thanks for having me, Luke. I did not know that you just drove 16 hours, so it's an honor that you drove back just for this.
Well, it's so important. I've been teeing this up on social media, Dr. Flory, because of how personally I'm actually getting choked up right now, Ginger. I think I might cry before you. So as I said, it's a personal one, but I've been teeing it up on social media, just how important this is for pet parents, because I'm sold on Onco K9, and I wanted to preface this episode anyway with that, because I want to ask some tough questions, and I think we had some difficulty with the process. It took I think, a lot longer for whatever reasons. We'll get into that. But I want to preface this by saying I'm an absolute believer in it, and I will have my Fuzzybutts tested with it every single year. So before we begin our personal story, Ginger's and mine, with the Onco K9, Dr. Flory, let's go ahead and break down again and remind the audience about the technology, how it works, the cancers it tests for, and the percentages and so forth, so on and so forth. Go ahead, please.
Sure. Yeah. Well, again, thanks for having me back. So just a review of the test. The test is called Onco K9. This is a blood test. So it's a simple blood draw that you can have done at your veterinarian's office. And it's a multi-cancer detection test. And what this really means is that it can detect cancer with a blood draw. The types of cancer that it can detect are all of the most common ones. So, all of the most common cancers that we see in dogs. And in fact, in the top 3 most aggressive cancers, which are lymphoma, hemangiosarcoma, and osteosarcoma, the detection rate in that group is 85%. And the detection rate in the top 8 most common cancers that we see in dogs is 62%. So it can be used in a couple of ways when we're thinking about a dog that is at high risk for cancer, for example. It can be used as a screening test. So this would be in a dog for which there's nothing that makes the veterinarian suspect cancer currently, but they're at high risk, maybe because of their age or because of their breed. So we know that dogs over the age of 7 have a 9 times higher risk of cancer. So it's recommended to start that annual screening at the age of 7. But we also know that there are some dog breeds that tend to get cancer earlier. And so for some dogs, it actually makes sense to start screening as early as the age of 4. And so if we think about what breeds those are, some of the giant breeds should start at the age of 4. Actually, boxers are at the age of 4. If you're wondering what your own breed's exact age should be, we actually have a tool online called the Cancer Safe tool. You can find that at cancersafe.petdx.com. And you can go in there and enter your dog's age, breed, and weight and find out, for my individual dog, when should I start cancer screening for this dog? So that can be a useful tool. The other situation that veterinarians would use this test for cancer detection would be if they do suspect cancer. Maybe they suspect it based on something they can detect on exam, or something that's happening at home, or some clinical sign that they have, or even something that they can see on imaging. And so this would be a test that we call aid in diagnosis. So the veterinarian suspects cancer for some reason, and this could help them tell, is this, is what I suspect, what I can see, what I'm suspicious of, is this cancer versus, something else on my list of possibilities. So when the veterinarian kind of gets that result back, it really tells them if a cancer signal is present in this patient. And that can really tell them, what do I do next in terms of the workup, and can kind of help guide the next steps.
I want to go over a statistic. I just heard you say that was staggering. So dogs over the age of 7 are 9 times more at risk for cancer. Is that correct?
That's right.
Staggering number. I really like, and I just recall Ginger was not just social media. We also talked about PetDx in this upcoming episode on TikTok and Facebook Live.
Right.
I couldn't recall the age that you're recommending, and I know it's breed specific. I understand that there are a lot of maybe a few variables in that equation, but I'm glad that you're actually recommending for some breeds the age as early as 4, because one of our dear friends, Signe Strasser, just lost her Bernese Mountain Dog. Ginger, remind me, which one of hers do you recall?
Bindi,
that's right. Named after Bindi Irwin, I guess, Steve Irwin. That's right. I can't believe I forgot that. And Bindi was 5, and it was hemangio, right, Ginger?
correct. Bindi's got sick like one day and she was gone the next. I mean, it was that quick.
2 days. So that recommendation, perhaps because hemangiosarcoma, and I want to reiterate the data actually for the audience, is that for the top 3 cancers, hemangiosarcoma, lymphoma, and osteosarcoma, it's an 85% success rate, or is that the correct term, success rate?
Or detection rate.
Detection rate, thank you.
The other word, yeah.
Detection rate. So for our audience, and I'm sure we're going to get in this again, is that I would absolutely adhere to Dr. Flory's recommendations that certain breeds, large breed dogs, I'm guessing histiosarcoma also on your list of one of the 62%, or one of that big batch of cancers that you detect?
It's in the list of 30, yeah, and we have a high detection rate in that cancer as well. I mean, that's certainly a cancer type that we worry about in Bernese Mountain Dogs, unfortunately.
Correct, and it can hit them early too. And it can hit them early. I've actually seen, Ginger, I think we've seen bone cancer in a burner as early as 2 years old, I think. So you're right. It's hard to think about 1-year-old and 2-year-olds. Maybe you can make a case, but I know with my fuzzy butts, if I ever have fuzzy butts again, because I've lost 3 dogs and all 3 to cancer. So of course I will, but I'm going to start mine with this Onco K9 at a very early age. So as I said, and I'll say again, I'm a tremendous advocate of it now, because in our use case scenario, they're 100% accurate. It seems like, knock on wood. Let's see. All right, so to walk us through the process of, before we get into our story and how Ginger and I, since we were really early adopters here in Memphis, because when we had our first discussion, Dr. Flory, back in episode 15, I didn't look up the date. I forgot to do that, but it was months ago. I was
sometime in June, I think, May or June.
Thank you. That's important because there has been a considerable lapse of time throughout this whole process. But ever since we talked back in June, I was excited to be a beta tester of it. So for the average pet parent, once they hear this, and hopefully that I can speak as passionately to you as I can about this, you decide to call up your vet and say, hey, I want to get my dog blood tested. Walk us through, Dr. Flory. How did they do that, please?
Yeah, so the test is a typical blood draw, but it does require some special blood collection tubes. So what that means is that your vet needs to have a special kit to be able to perform this test. And they can get the kit from our company, which is called PetDx. They can also get it from some of the major diagnostic distributors that they may already use, like IDEXX and Antech. So they can contact IDEXX and Antech and order the kits through them. And then you'll basically make an appointment for a blood draw visit. Sometimes your veterinarian will do an exam at that visit. Often that will be kind of at a wellness visit sometimes if you're kind of due for that annual wellness exam. And then it's a pretty typical blood draw. It's and essentially what happens is they pull the blood sample and they send the blood to our lab in San Diego. It's about a 7 to 14 day turnaround time once we receive the sample at the lab, and then the results will come back to your veterinarian.
That's and it is that easy. So Ginger, let's go ahead and start there. Segue perfectly into our experience, because once we talked, I think in June, I think there was the delay in actually getting the test to the veterinarians, but I immediately had both of my fuzzy butts tested. And Ginger, you had a number of your dogs, but walk us through that day at Dr. Covington's office.
Where you had Indy and Grayson tested?
Yeah, weren't you there, or was that just me? I can't recall.
I don't remember. I think I was there. Yeah, we were both there.
Correct. I just couldn't recall the specifics, but my recollection of it was it being a very easy process. There was just a blood draw, right? There's nothing exceptional about it, but it's very easy process. And then so once there's a blood draw, did you already go over, Dr. Flory, what happens next once the blood's drawn?
So yeah, from the time that the blood is drawn, then the veterinarian is going to send that into our lab, and that's either it comes directly to PetDx, or if they're using one of the diagnostic labs, then they send it with the regular courier service. So Luke, you had 2 dogs tested, I think, is that right?
Indiana and Grayson, correct. Absolutely.
And Grayson, that's right. And they were feeling fine at that visit, right?
Yeah, absolutely. It was no complications. That's why I have very little recollection. That was right when that's right when it was starting to heat up, planning for walk 3. It's just been I've been on the road for the past 6 weeks. Well, actually, I've been on the road a lot longer than that in preparation. It's been a crazy number of months. So that's why I was kind of leaning on Ginger, helping me recall. But she failed at that, though. I was leaning on you, Ginger.
I did, because I couldn't remember if I had gone with you. And then I remember keeping because Indiana's not so crazy about Grayson, that we were keeping them apart in the room. But the whole process for them was just simple. It was like a regular.
Right. That's why I have no recollection of it. It was not problematic at all. Dr. Covington was great. She was very well versed in the technology and Onco K9, and it was a good experience. It did from that actually, and then actually I think getting results took a little longer for one of the test patients, but we'll get into that in a second. So the results are in. It's hard for me to say this after what comes next, but I wanted to go ahead and get my 2 off, discuss them first before we get to Ginger. Well, Ginger's are mine too. I should also preface that her kids are my kids, so this has affected both of us. But let's go ahead and get just Indiana and Grayson. They both came back negative, I guess, on for everything, and they're feeling great. Knock on wood, cancer-free, no problems at all whatsoever.
That's great. And Luke, what if I can ask, if you can remember after the test was submitted, how did you feel after the test? Like when you're sort of waiting for the results?
Anxiety, of course, because Indiana's 10 and he was not symptomatic of anything. Because for me, like you said, this is screening. This is something I'll be doing annually as a screening. So neither Grayson nor Indiana were symptomatic at all. But still, you have that concern. Like I said, I've had 3 dogs die. Mine personally, I count Ginger's as mine as well. But I've had 3 dogs die from cancer, or die, and they've all died from cancer. So I'm 100%, with cancers and my fuzzy butts. So of course, a 10-year-old dog, Indiana, I've got that concern. I've seen, and they've all been 3 different cancers. My first one, osteosarcoma, second one, nasal adenocarcinoma, third one, mast cell cancer. So, so you're always worried about that thing that you're not seeing. Okay, can't detect any lumps or bumps. You can't detect this, but there's always that hidden thing in the inside that you're not seeing. Because by the time that Murphy became symptomatic with nasal adenocarcinoma, the tumor was already so big in his head that it was inoperable. And I took him to Steve Withrow at Colorado State University, and he wouldn't do it. He's a surgeon. He'll cut anything. And so just think back then, if I'd had Onco K9, you know, I forget dates because I have so many dates in my head. Murphy was diagnosed at 10, past 11 years old. So I would certainly have had him tested. Absolutely, had Onco K9 been accessible. And in that instance, that could have been life-saving for him, because had we detected the nasal adenocarcinoma earlier enough, I would not have had to go to radiation. We could have had it potentially excised and then done, of course, prophylactic radiation or follow-up radiation as well. So that's another reason why, Dr. Flory, I just can't. I'm like a spokesperson for you and Onco K9, and will be, because it would have affected the outcome, I believe, of all 3 of my. Well, Hudson would be the exception, because we knew Hudson's a mast cell cancer. You know, he's had mast cell tumors for 10 years. He had mast cell cancer. So on that, and that it's talking, I guess, about my own personal experience. Let me open the floor and let Ginger talk about her experience as well, and her kids, the kids that she had tested. Ginger, go ahead.
Well, first off, let me say that 1 in 3 dogs are diagnosed with cancer in their lifetime. So never, ever take 3 dogs to get tested by the PetDx. I'm just putting that out there. Make your appointments on separate days. So, you know, the whole process of having them tested was, you know, just like it was with Luke, except of course Sadler, because Sadler did not like anybody messing with him. And so they actually had to sedate him to actually do the blood draw, which I don't think is normal for all dogs, but
right. Most dogs don't need a sedation for this or any blood draw, as we all know. You know, a lot of our dogs have blood drawn frequently. That's something that vets do every day. So that's not typical, but if it is necessary, it doesn't interfere with the test. So that's important to know.
Yeah. So, so if I go, let me go back a little bit, if you don't mind, Luke, with Sadler from like a year ago. So Sadler, in probably September, October of 2001, let me trim his toenails. It was the first time I've ever been able to trim his toenails for the time I had him, and I had him for about 10 years. He was not originally mine. And, you know, I just thought that's odd. And I kept thinking about it. And so I made an appointment with Dr. Nollner, his veterinarian. And I just said, I want him checked from snout to tail in every way. And so she couldn't find anything. And then she said, let's do an ultrasound. So we did the ultrasound, and it came back that he had a mass on his spleen. So he had the mass and his spleen removed, and that came back as negative for cancer. It was benign. So hallelujah at that point. But the reason that I even thought there might be something wrong with him was a change in his behavior. So of the 3 dogs that I took in to have the Onco K9 test done, he was the one I thought, if one came up positive, that it would be him. And you can, and if you have any questions, you can just interject. But so unfortunately, so you asked Luke about the time frame. I was a little anxious waiting for the test results. I think I called Dr. Nollner's office, maybe no less than 3 times. And, you know, when it came back that Sadler was positive, you know, then we started running all the tests on him. And so I think we did ultrasound, blood work, chest x-rays,
Well, let's maybe talk about those results and kind of what all of that
Okay.
means. It sounds like you both had some anxiety during that waiting period, but it also sounds like you were a bit relieved to sort of have an option. Just kind of hearing and knowing the history of Ginger, your past dog, and Luke, your past dogs, of course, and your experience and knowledge of cancer, that there's sort of some that there's a little bit of excitement or gratitude that there's now an option that we can actually do this. So even though we have anxiety during this testing period, we know that we're doing something. We're able to act, which feels good, I think.
Exactly. I knew if we got a positive test, then we could figure out what it was, and then we could fight it. I mean, that was my whole thought process, especially, from the Puppy Up Foundation. I'm constantly, early detection is going to save lives, so that I was totally, there was anxiety about it, but it was kind of like, if somebody comes back positive, then we know what we're doing. I know what I'm dealing with before it's too late.
Yeah. Well, let's talk about what those negative results mean. So Luke, you got negative on 2 of yours. And what do I mean by negative is that the result that the vet actually gets back is cancer signal not detected. So what the test is really looking for, it's looking for essentially spelling mistakes in the DNA that are free floating in the blood. And that's called cell-free DNA. So it's looking for these little tiny pieces of DNA in the blood, and then looking in those little pieces for basically spelling mistakes that are associated with cancer. So if we find those, that's called a cancer signal. And if we don't find those, that's the result is cancer signal not detected. So when the vet gets that cancer signal not detected result, it's good news, right? It makes us feel good. It's, the thing that we always have to remember with any test is that false negatives and false positives are always possible. So we have to keep that in mind a little bit. This isn't a diagnostic test, it's a screening test as well. So it means that it's a piece of the puzzle, it's a piece of information. It's not completely foolproof. So we have to kind of keep that in mind. Some good news is that a study that we just did looking at a large group of dogs that had the test and then were followed by the veterinarian to sort of see what happened. When patients got a cancer signal not detected result, they were not known or suspected to have cancer in the follow-up period 94% of the time, which is really good. That's called the PPV, or positive predictive value. That basically means when we get a negative result, how much do we trust the test? How likely is it that this dog does not have cancer right now when we tested them today? So that's the important thing to know. The other important thing to consider is that if the veterinarian does suspect cancer in this patient for some reason, like something they can see on x-rays or something they suspect clinically, and they get a negative result back, because it can't detect every single cancer, if they still suspect cancer, they should still continue that workup. So those are kind of a couple of important pieces, but that 94% is really good peace of mind for you as the dog owner. When you get that negative result back, that's good peace of mind when you get that result back.
Absolutely. Obviously, it doesn't take the place though of still making sure that you put your hands on your puppy dogs, your fuzzy butts, as often as you can, and check them for lumps and bumps on a regular basis. That's for sure. All right. So Ginger, so
Can we talk about what the positive result means then?
Yep. Let's go back to that man.
Yeah. So unfortunately, Sadler got the positive result, and the positive result that your veterinarian received was a cancer signal detected. And again, this isn't a diagnostic test, so we don't make an important decision like treatment based on this test alone. Just like any screening test that we as people would have for cancer, like a mammogram or a PSA test or a colonoscopy, a positive screening test is meant to be followed with other diagnostic tests to find out what the problem is and to definitively diagnose it, so that then we can make treatment options. So generally what happens for a dog like Sadler is if we get that positive result back, we then start a workup. And this is kind of a standardized set of tests that help us to look in the parts of the body that cancer would most likely be found. And so it's a combination of tests like a thorough physical exam and blood and urine testing and x-rays of the chest and ultrasound of the abdomen, and then taking samples of any masses, lumps, enlarged lymph nodes, abnormalities that we can see on ultrasound to find out where is the cancer signal coming from. And that lets us kind of put a name on it, and then we can start talking about treatment options. So Ginger, do you remember, I mean, one of the steps in the process that happened for Sadler and happens with every positive case that goes out is that we have some board certified veterinary internists, and they direct our clinical support team, and they basically called your veterinarian, and what their kind of job is to help your veterinarian understand, what do I do next? Like, what do I do next in the workup? Where do I look? That sort of thing. And so they called and recommended a series of tests. And so then I think you brought Sadler in for an appointment for those tests. Is that right?
I did. I dropped him off like in the morning and picked him up in the afternoon, and they did everything on him that, you know, that your veterinarian there suggested. And the results, they couldn't find anything. Now, I know that there was some stuff with the ultrasound that they wanted some different views. And so, and the results from the ultrasound took extraordinarily long. I don't know if the lab was backed up. I have no idea, but it was like probably 3 weeks from the original ultrasound. And then I believe we took some additional views. I may not be saying the medical term correctly, but anyway, we did another ultrasound to get the additional views that were wanted. And then, but there was still, they couldn't find anything in the abdominal ultrasounds.
Yeah, so so this sometimes happens, right? So what happened with Sadler is he had some early testing, and he had an ultrasound, and one of our clinical support veterinarians called your veterinarian and said, I think we might benefit from a few additional kind of views, and let's try to get that scheduled. Some additional x-rays I think they decided to do as well to look, because I think Sadler was having some hip pain or something like that. And so then we didn't find anything, which is like, well, that's good, right? But we still have this positive result. So how did you feel at that point?
You know, there was a part of me that wanted to be really happy that we didn't find anything. But then there was that nagging other part that said, we just haven't found it yet. You know, it's there, but we haven't found it. And I know, I don't know if it was maybe it was your veterinarian, or maybe it was because from my vet clinic, Southern Crossing, you all dealt with Dr. White and Dr. Nollner. They kind of tag team because I think there were some vacations and things going on. So they went back and forth, but they both knew exactly, you know, what was going on with Sadler. So I believe someone had suggested doing an echocardiogram, and I'm like, well, what is that going to show me? What are the symptoms of that? And because, let me go back a little bit. Sadler actually had no physical symptoms of having anything wrong with him. Zero, zilch, nada, nothing. His breathing was fine. His energy level was fine. He, chasing the cat when she came out of her little hidey hole, you know, I mean, he was running around in the backyard. Even maybe 2.5 weeks before he passed, I was putting out a call on the internet for yoga mats, because he did have arthritis in his knees and his hips a little bit. And so he would zoom through the house and go sliding. So I thought maybe I could put one of those on top of a rug, or, you know, something to keep him literally from sliding. And this was in mid-October, probably like maybe about the 10th, 12th, something like that, that I was looking for yoga mats.
Well, go ahead and finish up the story though, Ginger. What happened, this series of events? Let's go ahead and finish up the story that you did, the results of the echocardiogram. And
well, so after that negative kind of workup, what will happen with our directors of clinical support, our veterinarians that are working with your vet, is sometimes they'll say, well, there could still be cancer that we haven't found. And maybe, we kind of talk about the history, and we knew that Sadler had a mass in his spleen last year. And there are some types of cancer that could also involve the heart, for example, if a tumor affected the spleen. And so even though it was benign back then, sometimes we can see that tumors either have some changes that happen later in the body, like some of those cells later become malignant and become cancer, or sometimes it was in that tumor that was called benign, but it was so small that the pathologist couldn't see it, for example, or it was just kind of a diagnosis that didn't exactly match, for example. And so sometimes we'll recommend that to go back and do an echocardiogram. So then after you had the negative workup, then at some point Sadler did develop some clinical signs. Is that right?
Correct. He started, because I have multiple dogs, I feed them in kennels. And so when I would put him in the kennel and I fed him, he started panting a little bit, but only when he was in the kennel. So I thought there was for some reason he had developed some type of anxiety about being in the kennel. And so I started feeding him outside of the kennel, and I didn't see that happen after that for a few days. And then I noticed that he wasn't tearing through the house again, but this is like just days. It was like one day he's fine and the next day he's not. And so I took him, because of the breathing, I took him back in to see Dr. Nollner, and it was almost exactly to the day 2 months from when he'd had his first chest x-ray, when we got the cancer detected diagnosis, or yeah. So, and she did, she immediately did a chest x-ray, and she was like, it's full of cancer. Well, obviously we didn't do it. We could have done a biopsy, and I was like, we're not, I'm not going to put him through anything else, because I did not want to have him given anesthesia again. So, from there, he seemed to be, not okay, but doing somewhat okay. And then we also did a blood test for him, just a regular CBC, and found out that his hematocrit had gone in that time from 32, which was kind of low, to 16. And I believe your vets there were asking, like, is he mobile? And like, yeah, he was walking around at that point still. He had just chased the cat the day before. Mm-hmm. So from there, it just kind of went downhill. I took him in, I started giving him, I think it's called PetDx, as an iron supplement. We put him on a couple of other drugs. I put him on some holistic medicine, but I had taken him in on Friday, I think it was. Well, I didn't take him in, but I went to see a doctor here in town that does some holistic stuff, and I got some Chinese herbs for him, and I started him on all that stuff. And then just Friday, he did not do well. He wasn't doing well at all. And Saturday, he was a little bit better. Sunday, he ate like a whole roasted chicken breast, it was like, okay, as much as he would eat, I just kept feeding it to him. And then Sunday night, I had been sleeping on the couch with him. He was like, no, I'm done with that. So we slept in the bedroom. I didn't put him in the bed with me because I was afraid he would jump off or something in the middle of the night and I wouldn't hear it, because my dogs just crawl all over me. I sleep through the whole thing, But then Monday morning, which was Halloween, he got up, we all woke up. I let the three other dogs, the girls, as I call them, out, and I came to help him because I had been helping him get up a little bit and walk. And he was like walking, he was meeting me in the hallway, and he walked outside. There are a few steps on the deck. I helped him down that. He went out, took care of his business, walked around in the backyard. He sat down, kind of surveying his land. And then he got up with very little help from me and came in the house, and literally he got back in the house, and I was going to lay him on the bed, and he looked up at me and just gasped for breath. And that was pretty much, I mean, I sat down on the baby bed with him and put his head in my lap and held him until he passed. But it was like that quick, from chasing the cat like 8 days prior to that to gone. And we did do an echocardiogram. I want to say somewhere around the 25th or 26th. And it did come back that he had he had 2 masses on his heart. Now, what he actually passed from, I don't know if it like something happened with the heart, if it was his lungs, if it was the fact that his hematocrit was 16, although on Friday when we tested it, had gone up to 18, which is still low, but we were on an upswing on that instead of down. But so you may know more of what it was actually that he passed from, or a combination of all, because I think you have all those tests, because we did do a necropsy on him to find out. So
Ginger, I'm so sorry. It's so sad. Sadler was such a handsome boy. You sent me a picture, and what a gorgeous boy he is. And
he was gorgeous, and he had a big personality.
Yeah.
And his nickname was Mr. Farty Pants. So that's one of the things when the test came back positive or detected cancer, is I always thought that he would wind up with some type of stomach cancer, because he had stomach problems his entire life. Mm-hmm. He was on, I think it's Tylosin, I never say it right. Okay. And probiotics and Gas-X for years. I was yesterday, I was kind of putting some stuff away, and I have like 2 big containers of Gas-X and probiotics. I'm like, well, at least the people at Costco now won't look at me like I have major problems every time, because I would just load up. I don't go to Costco very often, but I would load up when I would go, and I'm like, well, yeah, maybe I know somebody that needs some of this stuff, but
absolutely. Well, so I'm so sorry about Sadler. Unfortunately, what they did confirm on the biopsy of the 2 masses in his heart was that it did confirm a diagnosis of hemangiosarcoma. And that, unfortunately, is one of the most aggressive cancers that we see in dogs. And unfortunately, it can cause bleeding. And one of the supplements that Sadler was put on as a palliative treatment is called Yunnan Baiyao. And that is a Chinese herb that can help to prevent bleeding. And that's something that can be very helpful in patients that have hemangiosarcoma. So I'm so glad that he was on that, because it may have helped. But it's also possible that because of the hemangiosarcoma, that it could have caused bleeding, and that is why his red blood cell count, his hematocrit, was going down.
They never found in any of the ultrasounds, they never found any fluid in any place that it shouldn't be. So, and I think that Dr. Nollner had said, and you can correct me on this, because I know you all have communicated, that she didn't find any fluids or any blood or anything around his heart when she did the echocardiogram. So we were all like, where is it? So
yeah, and they can unfortunately, it can cause bleeding, and some of it can reabsorb, and so they can have bleeding events, and then it can reabsorb. And unfortunately, it can happen from the nodules in the lungs too. So hard to know what happened, but just so sad for you, and certainly for
what happened fast. And I need to reemphasize, Sad Man was my boy too. So it happened so fast that I was up in New York State when this was all unfolding, and I was 1,000 miles away, and never has 1,000 miles felt so far away. And I was hoping he would make it until I got home today, but he didn't. But that leads me to the next point, because one of the things I preach to no end is that cancer happens so fast in dogs, because the the time in which they become symptomatic, typically the cancer is very far advanced, as we know. And one of the things that I find is so promising about your technology is the success rate. But for this situation, the process time was so long. I don't think it would have changed the outcome, sad man's outcome at all, given how advanced everything was and how the cancer was metastatic and he was riddled with it. But it seemed a long time. How long, Dr. Flory, does it normally take from a positive detection to pinpointing the actual cancer and then hopefully having a treatment plan? Because for Sadler, of course, there were no medical options, like Ginger was saying. It wasn't viable. So how long does that typically take? Do you know?
Well, a couple of things. There are medical options for hemangiosarcoma of the heart. So just anyone that's out there listening, there are options for that. So so that's one important thing
No,
to know.
I said there wasn't for Sadler, just to clarify. I know there were medical options. I just said in Sadler's case, there weren't medical options. So
Right, because on that workup that was done initially, it wasn't immediately evident. There wasn't, and we don't treat based on the Onco K9 test itself. But let's say the heart tumor had been found, then there are options when we find it. From the time that we issue the report to achieving a diagnosis, in a recent study that we did in a large group of dogs, the average time was less than 2 weeks. So typically we do find where the cancer is, and then we're able to kind of make the steps to develop a treatment plan in less than 2 weeks for the majority of dogs. So Sadler's situation was a little different because it was happening in a part of his body that wasn't immediately evident on some of, like, it couldn't be seen on those initial x-rays, for example. But most dogs, we find where the cancer is and can achieve a diagnosis in an average of about 11 days, so less than 2 weeks for most dogs.
Well, I think in our case, actually, it took a long time. Actually, we lost weeks actually getting the actual tests themselves. So that kind of begs the next question is accessibility, because in our case, I don't think Ginger, I don't recall if the veterinarians knew of Onco K9 prior to us coming to them, did they?
No, as a matter of fact, the day that I was talking to Dr. Nollner about it, just the day before, she diagnosed her own dog with hemangiosarcoma. And I was talking about this test, and I told her what cancers it detected. And she was like, why hasn't anybody told me about this? Like her, IDEX rep and the Antec rep, neither one of them had said anything to her about it. And I said, well, it's new. I said, but we're going to send it, we're going to get it. I'm going to get it, and we're going to test, a couple of my dogs with it. And she was really excited about it. And after this whole process, she's really, she's sold. I know she went to a conference, and they were touring one of the vet's offices, or maybe it was at a vet's clinic, and she saw the tests, the PetDx test, the container, and she was like, hey, have you used that yet? And the vet said, no, but we've got some just in case. And then she goes, they're sold now too. She said, I told them what we were doing with, how we tested your dogs. It was easy to test. And, we were working through stuff with Sadler at the time. So yeah, they are totally sold on it.
But
Exactly.
I
think.
But hold on a second. But in our case, though, we lost a couple of weeks actually getting them to the vet. So it's important to figure out how we can get to the vet clinics or the areas that don't know about Onco K9, that we get that information to them, first of all. And also the other thing was the pathologist took several weeks in our case. Was there a reason for that? Was that typical?
I think they're just backed up.
Yeah.
The pathologist?
Yeah,
it took many weeks for us to get the results back from the pathologist, and that's why we didn't do the additional echocardiogram. And anyway, I just wanted to point out, in our case, we lost a couple of months. I don't think it would have changed the outcome, but that is something that you've got a great technology, but certainly getting time is of the essence, as you know. It's just something that I wanted to go over.
And so, how do we help you?
Absolutely, that's how it's
into the vet's hands. I mean, I don't know that there's what we can do to help you get it into like the GP's hands. I'm sure you have that that line in with the oncologists.
Yeah,
But
so yeah, we certainly are making trying to make everyone aware. I mean, I think that's the biggest step is education. So education and awareness for veterinarians, from the specialists to the primary care veterinarians. I think that you know, when dog owners go to their vet and say, "Hey, I'm really interested in this cancer screening test called Onco K9. Can I get this test?" I mean, that's definitely, you know, them spreading the word even more to their
Yeah.
veterinarian, just like you did to your veterinarian. And then once they see the test, understand how it works, and then especially see this in real life and see this kind of unfortunately play out, but with, you know, the cancer detection that it kind of provides, then they sort of really understand how this fits into clinical practice. Anyone can go onto our website at petdx.com. There's a pet parents page that has a lot of information there about learning about the test, you know, what to tell your veterinarian in terms of looking this test up if they want to order the kits through their current diagnostic labs, or they can reach out to us and express their interest. They can also find clinics that already offer the test. So there's lots of tools online that they could go to and check out there.
Yeah, I'm as I said before, and I'll say I'm a tremendous advocate of the technology. We had 100% success rate or detection rate in our cases, and it's just a tremendous tool for pet parents. And so whatever we can do to help on our end with this podcast, and we're going to promote it a lot because it's very valuable information and it's transformative. It will change, I think. I believe. It actually just raised kind of the question in my head. Are you guys tracking the data for all this so that maybe you determine over time that the detection rates are earlier in cancer dogs? Are you tracking data?
That's a great question. So one of the studies that we're doing right now is called the Classic Study, and that is basically to screen dogs over their lifetime and have them tested with Onco K9 every 6 months from the time that they enroll throughout their lifetime. And some of the goals of that study are to do exactly what you just said, really show this ability for early cancer detection. Early meaning prior to clinical signs. So just like with Sadler, he was feeling fine when his test came back positive, and to sort of answer those questions of, how much earlier, what cancers are we detecting early? What kind of frequency is the best ideal recommendation for how often this test should happen? Right now, we're recommending annual because that's kind of what fits into the paradigm of care for most dogs, right? That's when most dogs see their veterinarian. But maybe, we might find from the study that it's more frequent is better, or, for certain individuals. We just don't know those answers yet. So we will always continue to be doing research to find out the best ways to incorporate this into clinical care.
That's wonderful. Do you track our data, or is that something that we have to opt into the study? How does that work?
So we, we just like I've mentioned, this large study that we did looking at tests that have been submitted to our lab, and essentially what we did with that is we reached back out to veterinarians and said, can you provide us outcome information on the patients that were tested? And from that, we got a pretty big response rate. So even though veterinarians are incredibly busy right now, a lot of them did take the time to respond and let us know, has this patient been diagnosed with cancer or not? And from there, we start to get really good information about, for example, when patients received a cancer signal detected result, cancer was found 90% of the time. That's an incredible number for any screening test, really. That is really sort of evidence of how well it's working. And, the unfortunate case of Sadler is kind of what we're seeing, that if they get a cancer signal detected result, ultimately they do find cancer.
I'm a firm believer in an N of one, the power of an N of one. And SADMAN is a perfect case of that. But I just want to reemphasize for our audience that the earlier you detect cancer, the better the outcome, the treatment outcome. That's almost always the case, if not always the case. So that we don't have to wait anymore for the clinical symptoms of cancer is just a tremendous thing. Because I know in my cases, months could have made a difference. So in my cases, this Onco K9 is a game changer. I think we were just talking to Craig Clifford about it, I think, on our podcast
We
that we have.
did,
Yes, so we did
exactly.
mention to new guys.
He
You
had
know
just
Craig
been,
Clifford? Yeah.
Yeah,
he
I
had
do.
just talked to you all at the VCS.
Yes, yeah, that's right.
Yeah.
Yeah, he's excited about your technology as well. So
Yeah. I was like, oh,
Doc-
Craig, you're behind. You are so behind, Craig.
yeah.
It's a
That was
wonderful
episode
experience.
15. We did that in June. So it's
So-
exciting, pet parents.
One of the things that I forgot to mention in the whole Sadler deal is that you all had a program called ACES, the ACES program, and that I did apply, which it was an advanced cancer evaluation support or
Very
something
good.
like
Yes.
that. Something like that. And I did apply for that, and you all approved that for Sadler, and that helped immensely, especially with that first round of testing and diagnostics things that we did for him.
Yeah, what the ACES program is essentially for eligible patients, it can provide some financial support to help find the cancer. And it's really to help veterinarians like yours understand, what do I do after a positive, help them kind of facilitate it and sort of go through that process. So I'm really glad that that helped for you and for Sadler.
It did. Now, is that program still going on, or has
It's a temporary program, but it's still going on right now. So,
Okay.
So it's still going on right now, but it's temporary. So we don't know exactly when it will end. Well,
I think that anybody that's eligible to apply for that should, anybody out there listening, because it did, if we had found the cancer in all those initial tests, it would pay for almost all of it. I think I wound up for those initial tests, it was like $50. So keep it up as long as you can. I know it's not, you can't do that forever, but it was really nice. And I believe I didn't see it on the website, I don't think, until maybe your veterinarian there, when she talked to Dr. White with my vet. Then Dr. White said, oh, apply for this, and gave me the piece of paper. And I was like, okay.
I was in the middle of thanking you, Ginger, for bringing that up, because I was going to thank Dr. Flory and PetDx for providing financial assistance to that process. It made a lot of difference in that. Just a wonderful program that you offer. And it does segue into typical cost of the testing, because I want to make this affordable somehow to pet parents all over the country, all over the world. So what is the average test cost, and is that being covered now?
The average cost is going to vary by location, by your veterinarian, that sort of thing. Most of the time it's around the $500 mark, somewhere around there. And so it's just, like I said, it just varies based on where your veterinarian is in the country and which channel they're kind of getting it through, meaning, are they getting it through the diagnostic labs, or kind of where are they getting it?
One of the things I was going to mention earlier, because once your dog hits a certain age, I get a notice from my vet that says, every 6 months they should go in and see their veterinarian. Now, that would be whether or not they're getting any vaccinations, and that's a whole nother thing, but let's just say they are. You would get your vaccinations at like your annual visit, and then your semi-annual visit is really just kind of a hands-on, is what I'm thinking, is a hands-on thing. So maybe if you don't want to be out that expense all at once for whatever your dog is going in for their annuals, you could take them for that semi-annual visit and do the PetDx testing, do the Onco K9 testing at that time. So it kind of splits up the cost of your cost of veterinary care over the span of a year.
Mhm.
Did that make sense?
Yeah, we're also seeing some practices are actually rolling it into their senior wellness package so that you know, sometimes you pay overtime or however that works.
Yeah.
So you might just ask your veterinarian kind of what the options are.
That's a great idea. So is insurance covering it now?
Oh yeah, I forgot to answer that. So insurance seems to be covering it for the aid in diagnosis use. And so what that means is if your veterinarian suspects cancer for some reason, it seems like some insurance companies are covering it for that reason, or most of them seem to be. We've heard occasions of them covering it for screening, but I don't think that that's widespread yet. So I would say stay tuned. You know, certainly we hope that that will change over time.
Yeah, we will stay tuned because I'm launching the Hudson's Hope Fund, and it's to pay for diagnostics and treatment of cancer in dogs. And it would be interesting as you wind down that program, potentially how to have a conversation with us about how to get the diagnostics paid, because advanced diagnostics are necessary for advanced treatment, gold standard treatment for sure. So anything that we can do to make it affordable for pet parents to get this annually, I'm going to be doing it. I'm just going to have to figure out how to budget that every year because it's worth it for me. It's not just the alleviation of anxiety. It changes the nature of the relationship, I think, to have that additional assurance. So is there anything, Dr. Flory, that you would like to go over about Onco K9 that I missed?
No, I think that you've covered so much of it so well. I would just emphasize again the Cancer Safe tool. So again, what SAFE stands for is screening age for early detection. And you can find that at cancersafe.petdx.com. And that allows you to find out what is the ideal screening age for my individual dog based on their breed, age, and weight, for example.
That's a wonderful tool. To say that URL again?
cancersafe.petdx.com.
Excellent. That's just a tremendous tool. I'm going to go do that myself. Ginger, did I miss anything that you know of, or did I screw anything up this time?
No, I don't think you did.
All right. On that note, I'd like to thank everybody for this powerful, important episode of Fuzzy Butts and Friends. We're back in the studios, and you'll have an exciting new episode next Tuesday. That's when we drop, typically at 12 a.m. on Tuesdays. You can also find us on our YouTube channel. That's fuzzybuttsstudios.com. Until next week, puppy up. Talk soon. Bye, guys. Thank you.
Bye. Thank you.
Thanks for having me.